Very good evening, friends. Meeting again after a gap of 3-4 days in the session of Materia Medica, and we have discussed the pathophysiology of Carbo Veg in the last lecture. So it was very important to know the action of Carbo Veg, how it is correlated with the pathology, how the chronic passive venous congestion due to the congestive cardiac failure or acute circulatory failure leads towards the Carbo Veg pathology. That's what we have discussed in detail in the earlier lecture, and very few things about the Allen's keynotes we have discussed. If you really read this Carbo Veg, then you will definitely understand this correlation, and then you will realize, yes, Carbo Veg, how it wonderfully works in such types of cases. We have discussed from the Allen's keynotes few things, the bad effects of the exhausting diseases, then the constitution of the Carbo Veg, then the causative factors in the case of Carbo Veg. All those things we have discussed. In last lecture, we have not discussed the case of Carbo Veg. Just now I was sitting and I have recollected one case from a very early in my practice. It was in 1994, 93, 94. I was practicing with my father, and my clinic was there, a separate OPD in our hospital. And one patient was admitted in our hospital by another physician, a case of alcoholic gastritis. In fact, and he considered it might be hepatitis, and he was admitted because he had tremendous vomiting and nothing was working. Severe vomiting with a weakness, prostration, and he was just 35. Nearly about 3 days consecutively, he has consumed the alcohol, and then he suffered from such a thing, and then he was admitted under his care in our hospital. And he was not getting well, even everything was going on. At that time, in 1994, there was a drug, ranitidine injection. It was very famous, and it was ranitidine was going on. Then at that time, the metoclopramide, perinom was going on. Then they have given even the domperidone also. But nothing was working. His vomiting was not getting settled, and he was having a very bad, mm, foul smelling eructations, and he is suffering a lot. He was having a pain in abdomen. He was having indigestion, and he was suffering, and he is suffering so much that he asked all his member to keep the doors open, to make fan fully blown over there, and nothing was going inside his mouth. He was continuously on IV fluids for 2-3 days. Then I asked that physician, Doctor, shall I add homeopathic medicine for this patient? If you say yes, that will be useful for this patient, and I'm quite sure it will work. He said, why not, Prasad? Yes, you can, definitely. I know this is my patient, but it doesn't matter. You give the homeopathy. If it works for a patient, it will be always better for him, and he will come out of this grave situation. So presentation was very typical. The fanning desire form, elements from debauch, elements from alcoholism was there. Severe indigestion with foul swelling, eructation. Eructation gives temporary relief. There is fullness in abdomen, vomiting, continuous vomiting, which is sour, bilious vomiting he used to have. And then I took the history, what you have consumed earlier day. He said that be, before coming admitted over here 3 days back, before that, I had consecutively 3 days I was taking the meat in my diet. One day we have taken the mutton, and next day the chicken, the third day the fish. I think there was problem with the fish which we have ate at that time. But what we are making the party, all friends were there, but they never suffered, doctor. I am the only person who suffered, and now I am feeling that I will not survive. It is so dangerous that I am getting so trouble and not getting settled after 3 days. I am continuously on IV. Even smell of food I could not tolerate. I feel very much disturbed inside. So I have considered giving him Carbo Veg 30 and let us see what happens. And I have started him Carbo Veg 30. First, I have given 3 doses consecutively and continued for tedious. After taking first 3 doses of Carbo Veg every 15 minutes, basically he passed a good eructations and thereafter his abdomen was settled. I asked him not to take anything by mouth for another 2-3 hours, even not water. And then he passed the stools thereafter and he felt comfortable. Then he himself asked, can I get the sugarcane juice? I said, why not? Take it in, but in small quantity, not directly in large quantity. He has consumed that sugarcane juice and nothing has happened, no vomiting, nothing. He felt better, in fact, energetic thereafter. Then even that he was asking for fanning, that has settled comfortably. And the evening, he asked for food and he has consumed the food. And then the physician came, same time he was eating. He was taking his dinner. The physician asked him, so how are you, my dear? And he said, since morning after taking those 3 doses given by doctor, I'm feeling absolutely better and I have washed the stools and everything and I have consumed sugarcane juice and now doctor asked me to take the dinner and I'm eating and I don't have any problem. That fellow, the physician, has surprised after seeing this acute action of the Carbo Veg. He asked me what medicine you have given. I said that it is Carbo Veg. He said, why? What is the action of Carbo Veg? I said that this is the Carbo Veg proving and this is very similar to the patient's complaint. We used to use the law of similar. He was very happy after doing that, after getting the result. So this is what you have to look for. Carbo Veg is the medicine where the spoiled meat, spoiled fish, um, alcoholism, which used to produce GI features and which are very troublesome, where the spasm is there, the eructations are there, the sour eructations are there, which are not giving the relief or gives very temporary relief. This is what the picture of Carbo Veg and the GI features are there. And general modality or general association compound and symptoms craving for air. So this is the case which I have to discuss with you. Let us start with the next paragraph. I think we have finished up to the bad effects of loss of vital fluids. That paragraph we have finished. We'll start directly with the weakness of memory and slowness of thoughts. This is carbon. These are features of carbon, weakness of memory. It's carbon, weakness of memory, slowness of thought, slowness in activity. These are very typical carbon features and which are there with the Carbo Veg. Epistaxis in daily attacks. See, daily epistaxis, daily bleeding from the nose for weeks. Worse from exertion. So little bit exertion and immediately the bleeding from nose. Face is pale before as well as after the hemorrhage. So there is pallor which is there and that anemia is because of loss of vital fluids, loss of bleeding, and that's why the face is pale before and even after the hemorrhage. Hemorrhage from any mucus outlet. So this is also a hemorrhagic remedy. Here one characteristic is that it is in the systemic hemorrhage in the system broken down, debilitated, blood oozes from weakened tissues and vital force is exhausted. Where strength is lost and blood is oozing. Little bit arterial, little bit venous. Both things which are there in case of Carbo Veg. It is not a forceful bleeding, only nasal bleeding, which is also drop by drop. The from the nose, it happens to be there daily. Hippocratic face. Hippocratic means it looks very dangerous. When it happens, when patient is on the verge of death, going towards the death, the face becomes absolutely dangerous. Hippocratic, very pale, grayish yellow, greenish, cold with cold sweat, and Hippocratic face after the hemorrhage. Cold with cold sweat, the face is cold, head is cold, the with cold sweat. Still ask for panning. That is very difficult with the carbo. Looseness of teeth, easily bleeding gums. So teeth are very loose. There are bleeding gums. Patients crave things that make them sick. The old toppers crave whiskey and brandy. This is the problem of the carbo. They crave the alcohol in any form. And it says old toppers craves the whiskey and or brandy. Patients want clothing loose around the abdomen. We have learned the patient wants clothing loose around the chest is the lachesis, or around the neck is the lachesis, even around the waist is lachesis. This is one where the abdomen loose around the abdomen because of the distension. It is an embarrassed feeling because of distension, because of which he wants the clothing loose around the abdomen. Weak digestion, the simplest food disagree. Digestion is so disturbed that simplest food disagrees. Excessive accumulation of gas in stomach and intestine, aggravated by lying down. The sentence which they used to use in such types of cases, doctor, it is so dangerous that I could not understand, I cannot take the breath. And in Marathi, they use the one sentence, वरचा श्वास वर आणि खालचा श्वास खाली राहतो डॉक्टर, अशी परिस्थिती होऊन जाते. That is very difficult. That explains in Marathi, but in English, they says that they cannot breathe properly. The upper half, where whatever the inspiration happens, it never goes inside, and the abdominal distension that remains over there, and there is nothing comfortable situation which happens to be there. This is carbo veg phase and associated with craving for air. Weak digestion after eating or drinking, sensation as if stomach would burst. So severe is the distension. Weak digestion with effects of debauch. Debauch means this, like alcoholism, like smoking, like durvartan. Late suppers, those who used to sleep very late. Weak digestion because of rich food. Rich food means such like meat or very spicy, oily things. Irritations gives temporary relief. Patient never gets settled completely. Temporary relief is there because of irritation. Disease of venous systems predominate. Sulfur. So venous system, this is a very important remedy. Again, a remedy like argentum nitricum, symptoms of imperfect oxidation. So this is again very important feature which you can get in this remedy. Deficient capillary circulation causes blueness of the skin and coldness of the extremity. So it is circulatory failure. So capillaries never gets filled with the blood, and that because of which the redness is lost, because of which the pallor is the thing, or sometimes if venous blood accumulated, it gives the blueness to the skin. Vital powers nearly exhausted because loss of circulatory failure. Desires to be constantly fanned, air craving, craving for air continuously. That is very important. Hoarseness. Hoarseness is aggravated in the evening, damp evening air, warm weather, warm wet weather. Hoarseness, the voice fails when exerted. If hoarseness is aggravated in the morning, it is causticum. Awakens from the cold limbs and suffers from cold knees at night, like Apis mellifica. But Apis is hot, Carbo Veg is chilly. This is the difference between these two remedies. Awakens from the cold limbs and suffers from cold knees at night. Frequent involuntary cadaverous smelling stools, followed by burning. Soft stools voided with difficulty, like alumina. So constipation is one of the important feature which you can find it out with this remedy more commonly. And sometimes if your remedy works, this constipation gets relieved. but patient's stools, they are very typical of the cadaver smelling. In the last stages of disease, with copious cold sweat, cold breath, and cold tongue, voice is lost, this remedy may save the life. So, any disorder, acute disorder, where it leads to the circulatory failure and shock state, to bring that patient up again into the life, Carbo Veg is a wonderful remedy. Many takes it wrong way. It is not a senile remedy where the death is approaching and Carbo Veg will save the life. It's not like, it is not a senile death. Patient is on the verge of death because of the circulatory failure and it is secondary to some disease. One must understand this difference. It is not senile progress of the disease. And that's why this is an acute phase. Carbo Veg works beautifully. It acts very fast. So acute action of Carbo Veg, one should not forget in such types of cases. So it is one important difference that Carbo Veg is the remedy for the acute disorders leading towards the circulatory failure. Relationship, the complementary is Kalikab, the Drosera and Phosphorus. Here only the Kalikab is given. Please add Drosera is one more complementary to the Carbo Veg. Even add phosphorus, it is given in by boric. Phosphorus is also complementary to the Carbo Veg. Want of susceptibility to the well-selected remedies like opium and valeriana. So if your remedy is not working and not showing any action, must give the Carbo Veg. It stimulates the life. It stimulates the life force and starts showing the futures. So want of susceptibility to well-selected remedies, in between you can give either opium, either valeriana, either Carbo Veg. Compare cinchona, again as remedy for indigestion with flatulence of the whole abdomen. Plumbum in neglected pneumonia. So pneumonia, in neglected pneumonia cases, plumbum is one more remedy. Plumbum has the constipation, which is very typical of the hard ball-like stools which are there with the plumbum made. Plumbum in neglected pneumonia, especially in old toppers. Antimpad in threatened paralysis from inability to expectorate loosen mucus. But antimpad, it is great rattling, full of mucus and phlegm. It is not like a Carbo Veg. Opium with lack of reaction after well-selected remedies failed to permanently improve, like valeriana. This is one more remedy, Carbo Veg. You can give a single dose to stimulate the action of remedy. Phosphorus in easily bleeding ulcers. Pulsatilla, the bad effects from fat food and pastry. Yes, pulsatilla is very important remedy in bad effects of fat food or pastry. Arsenic, already I have told you yesterday that it is a very important remedy in sausage poisoning. Sulfur, acrid smelling menstrual flow and erysipelas of the mammy. The sulfur is one remedy, Carbo which you can compare and use. General modalities of the remedy. Aggravation from butter, aggravation from pork, aggravation from fat food, aggravation after quinine bark and mercury, aggravation from singing or reading aloud, aggravation in warm, damp weather. So general modalities are very typical. The fatty food cannot be tolerated in any form. So pork also contains fatty food. So rich food always causes trouble for the Carbo Veg. Amelioration from eructations and amelioration being fanned. That is, these are two modalities which are there. This remedy has a dip action. It is 60 days action. This is a long acting remedy. It is in low potency. Whenever you are using, you can repeat it. In high potency, in frequent doses. It antidotes, that is not given over here, but it antidotes ambra, arsenic, camphora, coffea, and lachesis. So 5 remedies it antidotes: ambra grigia, the arsenic album, the camphora, the coffea, and lachesis. And this remedy gets antidoted by China. This remedy antidotes others, that is China, Merck, and Lachesis. So, Carbo Vegetabilis is a very important remedy in your practice. It helps a lot in such types of acute emergencies where circulatory failure is happened due to some secondary disorders. So generally after acute disorders, when patient goes into the circulatory failure, producing chronic passive venous congestion and craving for the air, this remedy is a wonderful remedy. Second, it is very having very smart action on the GI system, producing indigestion, the fullness, the flatulence, the irritations, and all those things and all that stuff because of drinking alcohol and sausage poisoning or spoiled meat, spoiled fish. This is a remedy one should not forget. So we have finished Carbo Veg in today's session. Tomorrow we'll learn some any other remedy. That's all for today. Any question, we will have a chat.
Sir, in
Yes.
the COVID cases,
In
in Corona cases,
uh,
they crave for air. No, they use the meter in the fingers and check the oxygen. If the oxygen level is low, we can give Carbo Veg.
uh, it depends. There are many. You have to find it out a remedy specifically for the patient. Not always the Carbo Veg. Carbo Veg is generally a circulatory failure. It is not a pneumonitis which is producing craving for air in Carbo Veg more commonly. It is because a patient has gastroenteritis, having vomiting, and he goes into the circulatory failure, and then it is a wonderful remedy. In pneumonia, yes, it has a role, but all the features should match. Patient craves for oxygen, patient craves for air, there is a air hunger. And then, yes, it might be one of the important remedy in that pneumonitic cases. Okay. Any other query?
Um, sir, I have two questions. Hello.
Huh?
हा सर, अर्ली कॅटरॅक्ट आपण कॉन्स्टिट्यूशनल मेडिसिननी सर्जरी प्रिव्हेंट करू शकतो का? म्हणजे
नाही.
अर्ली कॅटरॅक्ट आहे.
पुन्हा एकदा प्रश्न विचारा.
सर, अर्ली कॅटरॅक्ट आहे पेशंटला.
हा.
कॅटरॅक्ट जस्ट आता स्टार्ट झाला आहे आईज मध्ये. तर मग कॉन्स्टिट्यूशनल मेडिसिननी आपण म्हणजे स्टॉप करू शकतो का? कारण आता तर ऑप्थल्मॉलॉजिस्ट
You cannot stop. This is
ऑप्थल्मॉलॉजिस्ट
what is cataract? Cataract is the degeneration of the lens. It is the aging process which will going to happen. Only thing which you can do is that you can prolong it.
अच्छा.
If it is happening early, you can prolong it. If it is happening early, it is itself is an indication of syphilitic miasm.
ओके. ओके.
Yeah.
मग कॉन्स्टिट्यूशनल म्हणजे फक्त
Constitutional with
प्रोलॉंग करू
syphilitic
शकतो.
remedy, yes, definitely.
ओके ओके. अजून एक विचारायचं होतं सर. एक पेशंट आहे माझी, म्हणजे तिने सर्व्हायकल कॅन्सरचं वॅक्सिन घेतलंय एक. आता तिचं दुसरं ड्यू आहे 24th ला. तर मग आता तिचं कॉन्स्टिट्यूशनल सुरू करायची आहे, तर मी ते वॅक्सिन नंतर सुरू करू ना, आणि किती दिवसानंतर चालेल?
आता व्हॅक्सिनचे काय इफेक्ट होतात, दॅट ऑल्सो यू हॅव टू टेक इन टू कन्सिडरेशन इन अर केस.
हो हो. फर्स्ट याच्यामध्ये तिला फर्स्ट मध्ये तेवढं काही म्हणजे काही प्रॉब्लेम नाही झाला, स्टमक अपसेट होतं. तर ऑलरेडी ती एक घेऊन आली माझ्याकडे, म्हणजे आता 8 दिवसापूर्वी आली ती पेशंट. त्याच्यामुळे त्याचे ते 3 डोसेस.
One question is there in my mind. Vaccine which cost more than 10,000 rupees, how can it be possible to make it free for the peoples? My question is that if it is they are giving it freely, does the peoples are guinea pigs? Does the peoples are guinea pigs on whom the trials are having done? This is very important thing one must learn. How can it be
They are
possible?
charging 4,000 per vaccine.
So
They are charging 4,000 per vaccine.
This is the problem. That's a very important thing. Government has given it freely. How can it be? So that is very
Yes,
important
yes, yes.
question. One should not overlook. There is one question, sir. Is
आता
anti
त्यांनी एक घेतली आहे त्याच्यामुळे मी आता काही करू शकत नाही.
wait for some time instead of
मग आता
starting
किती
the
दिवसांनी
medicine.
दिवस साधारणतः
After a month.
ओके तरी पण 8-15 दिवस.
After a
ओके
month, 1 month.
ओके
Sir, is
ओके ओके
anti-miasmatic
ओके
remedy given without indication?
थँक्यू
If not, why?
ओके थँक्यू.
I could not understand the question, Amit.
Sir, I have attended one course.
Huh?
Like it's saying like with they had given some medicine for that, and after that, and within a week, they had given a anti-miasmatic remedy. So without indication, can we give that?
Without indication, we can give if there is a first important thing, if the patient its case is wholly blocked, there is no further progress and which is not improving, and if you know the miasm is clear with that patient, then you can use.
Okay. Okay. Thank you very much.
How gastric patients show panning desire symptom? How they show? No, it is a concomitant. Gastric symptoms itself are sufficient to produce. If there is a very severe distension in abdomen, patient becomes restless and crave for air. That is an individuality of the Carvo Veg. It is not always that pathology should happen over there to crave for the air. It is a concomitant. Okay. So thank you being there. We'll meet again tomorrow with new remedy and continue with our.
सर अजून एक विचारायचं होतं. हॅलो
Yes.
हॅलो
हा बोला ना.
हा सर मग अशा पेशंट मध्ये कसं म्हणजे काय ऍडवाइस करायचं अशा पेशंट मध्ये मग कसं काय ऍडवाइस करायचं कारण पेशंटनी तर एक ऑलरेडी वॅक्सिन घेतली आहे आणि आता गव्हर्नमेंट पण अवेअरनेस करते सर्वायकल वॅक्सिन सर्वायकल कॅन्सर जास्त म्हणते.
मी माझ्या पेशंटला स्पष्ट शब्दात तुम्हाला घ्यायचा निर्णय तुमचा, प्रॉब्लेम्स काय होऊ शकतात याच्या पॉसिबिलिटीज सांगायच्या आणि त्यांना यू कॅन कंटिन्यू विथ युअर ओन वे. मी सरळ सांगतो, इट डिपेंड्स ऑन यू. आय विल नॉट ऍडवाइज टू टेक. मी सरळ नाही म्हणून सांगून टाक.
ठीक आहे ठीक आहे सर. ओके सर थँक्यू सर.
ओके गुड नाईट.
मग तेच